Today I'm going to show you how to give a PPD the right way. First, you're going to need a syringe or tuberculin syringe. You're also going to need alcohol swabs, your patient's skin, and you will need a vial. Today we're going to use normal saline. First, I'm going to open up my syringe and I'm going to clean my patient's skin so that it has time to dry. Then clean my vial. So I'm going to open a brand new vial, make sure that the expiration date is still current, it has not expired, and then I'm just going to scrub the hub of this for about 10 seconds. And then I'm going to let that dry as well. And I'm going to pull air into my syringe, and it'll be the same amount of air that I'm going to then withdraw from the vial of solution. So I'm going to use 0.1, just pull that down to 0.1, and then I'm going to carefully uncap my syringe. So there's that, and I have my 0.1 there. Now I'm going to take it, insert it into the vial, and inject the air. Then I will pick it up and withdraw 0.1. Make sure that I have no air bubbles. If I have an air bubble, I can pull a little more of that solution out to push the bubble to the top. And then I'm going to push again until I get to 0.1. I need to look at the eye of the needle here, and I need to make sure that the bevel of the syringe is facing upward. Once it is upwards, I'm going to go to my patient's skin, and I'm going to pull their skin taut, and then I'm going to keep my angle at 15 degrees or less when injecting the needle. And I'm just going to stay on the surface level and in that way. And then I'm going to push and administer those fluids, and I should get a nice little bubble. Now, when I am done, do not recap the needle. We'll transport this to a sharps container for safe disposal. Like and subscribe.